Hey, welcome everybody, and thank you very much for joining our Learning from Local Places event. I'm Barbara Langer from Insight Angels, your host on behalf of Sport England and the We Are Undefeatable team. And this is our very first session of the 3-day event. This is actually the very first time such an event has been organised. So we're trying to make it as informative as possible. You'll hear across the next 3 days, if you attend the other sessions as well, from lots of different areas who've tried lots of different things in their places based on their different local contexts. And really the intent of this event is to share those learnings from what they've done far and wide, and hopefully empower others who may be looking to do similar things in their places. So before we start, just a couple of housekeeping notes. We will be recording all of the sessions, and we'll be making the recordings available following the event so that anybody can catch up afterwards. There may not be time in this particular session for a dedicated question and answer component at the end, as we do have quite a bit to get through to set the scene for the next 3 days. However, do feel free to pop any comments or questions into the chat as we go through, and it may be that colleagues at Sport England or We Are Undefeatable team are able to respond directly there as we go through. If I could ask everybody to stay on mute throughout, and just to mention that if you happen to find that the thumbnail images of the presenters are obscuring your view of the slide content, on the top right of your screen, you should find some viewing options. And if you click on view and then select side-by-side speaker view, that should fix it. But I'm going to hand straight over to Tom Burton at Sport England. Tom is the National Partnerships Lead for Health and Inactivity, and he's going to share some of the important context for the local activation work around the We're Undefeatable campaign. Over to you, Tom.
Thank you very much, Barbara. Good morning, everybody. Nice to see so many of you joining today. I'm going to be passing back to Barbara shortly, who's going to be giving a lot more information about what we've learned across a lot of this work. And I know that's the reason a lot of you have joined today, to hear through that, hear about all of that. But I think it feels really important because it's a 3-day event, that we give a bit of context to where it all came from. And I'm really aware that for many of you, you'll be very familiar with the We Are Undefeatable campaign, but I know a few of you are quite new to it, or have heard about it and have sort of dabbled in it a bit, but don't really know what it's really about, where it's come from. So we just want to give a little bit of context to that as well, but not to take up too much time in that area. Barbara, if we move to the next slide, please. So a really important place to start is just a couple of thank yous, really. Firstly, as you can see on this slide, the range of areas that have really been driving this work, the 10 local areas that have been really sort of test and learning, and who you're going to be hearing from over the next 3 days. I've done some fantastic work with a huge amount of passion and a lot of dedication. And also to Insight Angels at the bottom, of course, Barbara, who's really gone above and beyond to make this this event possible, and who you'll be hearing from shortly. So it's just a really big thank you for everyone's hard work. Next slide, please. So just to sort of step back really, and why the campaign was needed and where it came from. And some of this data is moved on since it was launched in late 2019, September 2019. So we know that that long-term conditions affect many people. So this is the norm. This isn't a niche audience, and I think this is something that was really clear when the campaign was launched. To the extent that 43% of people in England have at least one long-term health condition across all ages, and up to 40% of working age adults will have at least one long-term health condition by 2040, up from about 30% at the moment. And although I think also delving a bit deeper, about 27% of people are living with multiple long-term conditions, and this is something that we know the campaign really tries to look across as well. So taking some of the Active Lives survey data, you're twice as likely to be inactive if you're living with a long-term health condition or limiting illness compared to those who are not. But it's also really important to say here, this is not a homogenous group, and I think obviously people will be well aware of this, but a significant proportion of people living with health conditions are also achieving Chief Medical Officer guidelines and finding a range of ways to do that. So whilst you're much more likely to be inactive, there's also a significant proportion of people are finding a whole range of ways, and many of those living with 2-3 impairments find a range of ways to be active. So that's an important nuance, I think, to that stat. Something probably many of us would be familiar with, that if we reduce inactivity, we can reduce long-term conditions by up to 40%, and as well as that, helps to manage a range of chronic health conditions. And something we've learned a lot through We Are Undefeatable is a significant proportion of this audience really want to be more active, but feel there are significant deterrents to that. Lots of challenges that feel that it's in the way, and some of those are perceived, some of those are actual, and some of them are around the conditions and symptoms they're living with, but also a lot of it is around environmental factors as well, and levels of confidence and motivation. And this final one here is just something, I guess, is a bit of a no-brainer, but we know that activity manages stress, reduces isolation, improves well-being. We know people living with health conditions are particularly physical health conditions, are also disproportionately affected when it comes to mental ill health. And so as with such a strength of evidence behind it, being active is obviously one of the key pillars to maintain well-being for people living with health conditions as well. Next slide, please. So just to revisit an ambition that's really driven by trusted organisations. So Sport England is absolutely not the face of the campaign. We are one of the partners around the table where we invest lottery investment into this. You can see all of those, the logos of the national health and social care charities that are really the face and that drive this campaign. And there's a huge amount of passion and dedication from those charities to make this work. And that's the trusted voice. You know, the campaign's all about finding that emotive link. Oh, there we go. It's really important that that is the case, and this isn't driven by or really Sport England it's not seen as a Sport England campaign at all. But just the purpose is to support and encourage finding ways to be active that work with each person's conditions, not against them. Being undefeatable is understanding that how you feel can change from day to day. Everybody's situation is unique. Moving more when you can is just as important as accepting when you can't. And we believe collectively that every achievement, no matter how small it might seem to someone else, is worth celebrating. And that is a really important narrative of the campaign. This is about finding ways to be active, supporting and motivating ways to be active in a way that works for you. Next slide, please. So I'm just going to pass across to Kirsty, my colleague, shortly, who is also in the health and inactivity team. I'll let her introduce herself. But just to say, the way that we've approached activation of the campaign is twofold, really. So you're going to be hearing about the targeted approach to place-based work over the next 3 days, and some fantastic learning across those places. But we also want to support everyone to bring the campaign to life in a way that works with your organisation or your place. And so the Supporters Hub tends to be the way that we do that. And if you aren't already on the Supporters Hub, it's really worth going in and having it. It's constantly updated, so there's new information on there. We know we want to continue to improve that, and we want to work with supporters and partners to do that. And we need to probably get better at letting people know when things have been updated as well. So I'll pass over to Kirsty, who's just going to talk through a little bit about what is on there. Is that right, Kirsty?
Yeah, thank you, Tom, and good morning, everybody. My name is Kirsty McCoopy, and as Tom said, I also work in the health and inactivity team at Sport England. I manage various areas of work as part of my role, including the 10 We Are Undefeatable activation areas. But before we go into more detail on them, as Tom said, just a very quick overview on the universal activation via the Supporters Hub. To highlight a couple, I won't go into all now because there's lots on there. So as Tom said, we would encourage you to take a look when you have time, if you haven't done already. But just to highlight a couple of the key things that are in there. This is where you'll find further information on all of our amazing cast members, where you can hear their stories and follow their ups and downs of being active with a health condition. Each and every one of them are a true inspiration, and on the hub you can find social assets, videos, images, and lots of other supporting material. There's also lots of great activation ideas and motivational tools on the hub, such as the 5 and 5 and My Daily Undefeatable, and lots of great insight and information for healthcare professionals and our frontline physical activity workforce to help them have conversations about being active with a health condition. And also on the hub, you can find a little bit of further information around the activation areas, which, as Tom said, we'll be adding to over time shortly after the event. Next slide, please, Barbara. So in addition to the universal activation tools, at Sport England, we wanted to explore how We Are Undefeatable could be activated at a local level, taking a more systemic approach using the national campaign as a catalyst to better understand and address the barriers to support people with health conditions to be active. And we had two very simple aims, really. The first one was to do just that, to support local approaches to drive behaviour change in inactive adults with health conditions, but to secondly generate some comprehensive and shareable learning And that's why we're here today, because we're now at a moment in time where we feel able to share some of this with you. So what did we do? Well, we first identified 10 local authority areas that either had a high number or high proportion of the adult population living with a health condition. And this was coupled with some desk-based research to identify those areas for whom this agenda was a priority. And we offered some seed funding up to £75,000 to help support and galvanise the work. And this led to a mix in areas in terms of their geographical and demographic makeup, from rural West Somerset to more urban areas such as Liverpool and Blackpool. But we left it up to each of the areas to determine who was best placed locally to lead the delivery of the work, which again has led to a really interesting mix from local authorities, active partnerships, through to some voluntary and community sector organisations. And whilst each of these areas took a very different approach and perhaps looked at the opportunity through a slightly different lens, collaboration was absolutely at the front and centre for all of the work, which has been really important. And I think at this stage, it's also important to recognise that each of the areas had a very different starting point. So while some had well-established relationships with health and care partners, others were only just starting this journey. And as a result, both the success and impact to date looks very different from place to place, which we'll hear about more over the coming days. Next slide, please. So in terms of the work itself, we set very few parameters as we felt it was really important for the work to be driven locally by each of the areas. However, there were just a few things that we thought would help to focus the work. The investments were initially set to cover a 12-month period starting back in September 2019, but unfortunately the pandemic soon hit afterwards, and inevitably much of this work was delayed. So actually in reality a lot of this work has been taking place for the last 24 months or so. We wanted to ensure that the work was aligned with local priorities and delivered based on local need. So for some of the areas, actually a starting point was to gather further intelligence before they were actually able to co-design and plan what the work might look like for them. And linked to this, we wanted to ensure that each area either built on or enhanced existing local services, or used this as an opportunity to test a new idea. It was also important that the investment provided additionality over and above what they may have already done to activate the campaign. And we wanted to ensure that all of the work was in line with the wider campaign narrative. So it was really there to challenge those common misconceptions that we know that are around being active with a health condition, but also to reinforce that it wasn't just about simply funding new opportunities to support this audience, unless of course that there was local insight to say that was the need. But instead it was working to ensure that existing opportunities provided that right experience for people with health conditions, or could help to unblock any of the system barriers that might have prevented regular activity. And then lastly, we wanted to ensure that the areas thought about legacy. So everything you hear over the next few days are just a moment in time. And while some of the areas have got to where they'd like to be by now, others are still very much on their journey. But for all of the areas, we know that much of the brilliant work will continue. Next slide, please. And Tom, I'll pass back over to you.
Thanks, Kirsty. So I appreciate a few of you might be quite familiar with this slide. We presented it if you come along to some of the We Are Undefeatable webinars before, but this is just this, and you don't have to try and take all of this in, and you'd be able to do that afterwards, but this is a slide that just starts to look across the range of programs and approaches to support people with health conditions, ultimately through the lens of this is not in isolation. You know, this is part of a much wider landscape of work that's taking place. So you can see in the highlighted red boxes, or along the top there, I should say, along the sort of purpley lilac-y colour on the top, is ultimately about some of what we want the target audience to see, to feel, to have those regular touch points with a range of different networks around them where physical activity is embedded. So they would see it through the campaign, be the touch points with health charities, reinforced by healthcare professionals and link workers, but also have a really positive experience of being active. And then underneath in the pinky colour is just some of the enabling sort of systemic work that's underpinned a lot of that. So it's not to go through this in detail, but just to reinforce that really, that as you, and for many of you, if you're listening through today, or as you listen, attending any other sessions over the next 3 days, a lot of the areas have done exactly this. It's about the role and how you weave We Are Undefeatable as a campaign into some of this wider work. It's not sitting as a bolt-on piece. And I think that's really important in terms of some of the learning that others might want to take away. Next slide, please. So a familiar slide, I hope, for many of you in terms of uniting the movement and the 5 big issues that have been identified through 18 months, 2 years of co-design of what the strategy really needs to step up on and address. And I just want to say this work started before Uniting the Movement was launched, but really talks to some of the key principles that Uniting the Movement and that direction of travel of the strategy. So for instance, this work, and as you'll hear from the places, I've really had to navigate the pandemic as part of this, and had some real ambitions, as Kirsty said, before the pandemic started, around where the areas really wanted to use the campaign, and that had to meander and change as the pandemic went on. And actually, there's lots of opportunity. Some doors closed, but others opened, and that's been really a huge opportunity and something you'll hear about from a range of the areas. And then in the bottom right there, we've got around connecting communities. That's rooting this work in the people and the places that we most want to support. And that's exactly how this approach has taken shape, really, across the 10 areas, is making sure it is driven by local insight. It really does talk to local communities' needs, and that co-design has been there. And then obviously the top in the centre, really where this is, a lot of this work is also rooted with people with health conditions, connecting with health and wellbeing. So what we're seeing is lots of really positive engagement with colleagues in the health and social care system and local integrated care. We're seeing how we try to bridge that gap between where people are in receipt of health and social care support and then going into sport and physical activity. But it's also starting to build quite a robust evidence base and learning around what it takes to do this well, and actually and the starting point for that has been really, really positive. So I think it was just to sort of say that as we go forward, this way of working, it really speaks to the way that the strategy and that direction of travel. Next slide, please. Oh, there you go. I think that's it. So that is the very, very brief context of where the campaign came from and why we went down this sort of targeted place-based approach. And I'm now going to pass across to Barbara to take us through some of the learning that we've seen right across the 10 areas.
Thank you very much, Tom and Kirsty. So yeah, I'm going to walk you through a bit of an overview of some of the overarching learnings, having looked across all of the 10 areas and what they've been up to. So just to touch on some of what Tom and Kirsty already mentioned around the scene setting about the areas, what they all shared was a relatively high proportion of the population, or high number, living with long-term health conditions, and all clearly have an interest in addressing that population. But there were key differences in terms of things like population size, from the very sparsely populated West Somerset up to big cities like Leeds and Sheffield. So some mainly rural, some completely urban, and everything in between. There were different lead organisations in each area, and they had different starting points in terms of local partner relationships. And it's really the combination of those different factors that has led to such a wide range of approaches and some really great learning, which we hope you'll find really useful, and some of it applicable to your own context. So some of the approaches you'll hear about a little bit from me now in this session, but more in detail if you attend the area sessions, include partnerships with healthcare and social care. You'll hear about workforce development, which has been undertaken with a wide range of partners. There have been local ambassador programs in many areas. There have been different communication strategies, including a lot of localization, the promotion of physical activity offers, which were both new but also existing. And finally, there were a range of different approaches to gathering insight and getting feedback and consulting, some more in depth than others. So that's just to give you a high level overview of what we'll be talking about now and throughout this event. But before we get into the meat of it, it is important to acknowledge the impact of COVID across all of the different places, and all of the areas have demonstrated incredible flexibility with their work. When the pandemic first hit, any healthcare focused initiatives in particular tended to have to pause. Community organisations were stretched in new ways, supporting vulnerable people, and there were also reduced opportunities to engage with people with health conditions, many of whom were shielding, some who continue to be. However, as was mentioned, a few opportunities have arisen in the midst of all of this. For example, where there was a close relationship between the We Are Undefeatable local lead and community-based services, it was sometimes possible to build physical activity messaging through things like booklets into outreach such as welfare packages. It did also prompt some places to curate online resources related to getting active at home, as at that time there were a lot of online workouts flooding onto YouTube and things like that. And some places felt that as a trusted local voice in their community, they could add value by curating a subset of that material. What COVID has also done is raise awareness of the fact that some people may be isolated or may not be able to access online resources very easily. And so that led to new hard copy resources being developed, which absolutely remain relevant today. And finally, of course, it did force new virtual forms of engagement such as this, which, while not always everybody's first preference, can serve to broaden participation in meetings and in outreach. But moving on into the key areas of learning, one of the overarching themes, which is so important, is partnership working, and that's been absolutely critical to every single place. And just a quote here, which sums up why that is, from one of the pilot leads, who said, "We always knew this segment was going to be the most challenging to engage in physical activity and would need the greatest level of coordinated resource." And just sharing that because it's such a strong premise for what we see played out across every single area, this acknowledgement that you may need to work in partnership in order to have the kind of impact you want to with this audience, which can be quite tough to engage. You may need to come at it from multiple touch points. So all areas did understand that partnership working would be critical, and there was quite a localised approach to identifying who the partners should be, which tended to focus on two key questions. Firstly, what is the local context for the target audience? Who are they interacting with? Who is influencing them? What are their local support structures? And secondly, which local players actually have power and interest in the agenda? And ultimately, every area engaged with a really wide range of organisations, and some examples are called out here on the right-hand side, but that's certainly not exhaustive. And bearing in mind the importance of partnership working, one of the really key facilitating mechanisms for this was often the establishment of a steering group or an oversight group, built around the We Are Undefeatable agenda usually, but very often plugged into other existing local steering bodies. And there were several benefits to having this. So it was a good way to bring everybody up to the same level of understanding of the campaign message and campaign resources, and to ensure good information flow. It was also a mechanism through which that local assessment of local needs could take place, bearing in mind the many influences there are on the target audience. But mostly the areas talked about how through these groups they were able to build and strengthen relationships with community partners. And as we've mentioned, the areas had different starting points in terms of that. Some didn't have as many good, strong local contacts. So in those cases, sometimes developing a steering group was an achievement in itself. And in fact, some key principles emerged for how you might run such a group. Firstly, it was important to establish clear leadership. Sounds obvious, but it is so important that it's worth calling out. Having clear leadership can just help with momentum so much and enable everyone to get behind and there to be a system-wide push, so to speak. Important to also establish a clear remit. Some areas actually created terms of reference for their oversight groups in order to make that clear for everybody. Thirdly, when bringing diverse partners together who may not have worked together much before, it can really help to anticipate a question of what's in it for us and be ready to respond to that with something quite tangible. And the areas did this in different ways. So, for example, in County Durham, they created a whole marketing toolkit bringing together locally relevant We Are Undefeatable resources in just a really accessible way for their partners. Or it can be about having a tangible physical activity offer to bring to the table that others can immediately signpost to. There could be some debate about the right size for an oversight group, but really it's more important to have people who are engaged than to have lots of people. So it's engagement over numbers. Point 5 here talks to grounding everything in insight about the target audience. And there's actually a great deal of free insight available on the We Are Undefeatable Supporters Hub, but many areas also conducted their own local research or even made people with health conditions part of their oversight group. Establishing shared goals was really critical. And aligning the group with any relevant existing local oversight structures was important too, because while you may need the agility afforded by a separate We Are Undefeatable group, if it exists in isolation, it may ultimately struggle to become a long-term integrated priority. Delivering on promises just meant the leadership demonstrating commitment to supporting the members in various different ways, being a reliable presence. And finally, keeping partners engaged was really important because, in particular due to COVID, there were significant periods of time where not much could happen from the original plans, but some of our areas put significant energy into communicating with stakeholders regularly, even during those times, being a constant presence, a thought leader, sharing plans. And that just meant that it was much easier then to pick up conversations again later on. Finally, for this section on partnership, the most important partner of all is the target audience of people living with health conditions. And what many of the areas understood was the importance of informing initiatives through consultation with them. It isn't enough to look at the system. You have to understand the causal factors of inactivity in order to create good solutions. And the areas had a variety of different approaches to this. In Kirklees, for example, a lot of time was spent engaging in in-depth conversation with people in the South Asian community, really developing a rapport, understanding their lives and context. And that was followed by a co-creation phase. And if you attend their session on Thursday morning, you'll understand how powerful that was in terms of what they then went on to create. On the other hand, in Somerset, a large-scale survey was carried out to identify key barriers to physical activity, what people were interested in doing. And although that's a really different approach, it also gave a lot of impetus to the interventions they went on to deliver. There's not necessarily a right or wrong approach here, as long as there is that grounding in insight, but there are considerations to bear in mind. First of all, the more depth you go into, the amount of co-creation work you do is clearly going to impact on how quickly you can move to a delivery phase. And secondly, it is worth thinking about who is going to lead the insight or consultation phase. Of course, if you have the means, you can bring in an independent researcher, and through that you can get objectivity and robustness. But sometimes involving a member of the direct team or a stakeholder in doing that research can actually generate more ownership of the findings and therefore potentially a drive to create the right sustainable solutions. Moving on then, I'd like to share some learnings from the areas about engaging with different types of partners, including in healthcare and social care, community organisations, charities and volunteers. So first of all, in terms of health and care partners, many areas did engage with primary care networks and clinical commissioning groups, recognising that their representation was critical in the oversight groups just because of the influence they can have on the target audience. There were a really wide variety of roles involved: GPs, social care partners, social prescribers and others. And often the focus was to review care pathways and find opportunities to encourage physical activity at the front line, as well as to identify training needs. In terms of the learnings around this, there was a sense of a lack of capacity among healthcare partners, very much exacerbated due to COVID. Certainly no lack of willingness, but a lack of capacity to lead things. Another point was just how important it is to identify the right contacts. So there were a couple of areas who were trying really hard to engage with PCNs, but when they did tap into the right person, it galvanized everything because that person then referred them to other useful people. It's sometimes a challenge because physical activity doesn't necessarily sit with one person. One area talked about the importance of putting a lot of effort in to engage with the CCG at different levels. So making sure you're influencing the senior leaders, the middle management, and those in more operational roles. And interestingly, it seemed as though the middle management was where it was hardest to get traction. So you may have to persevere with that on multiple occasions. Another interesting finding was that social prescribers seemed to represent a particular opportunity in a few places. They demonstrated real receptivity to campaign resources and to training in new approaches. And they also occupy an interesting position with respect to the target audience. They do have some authority from being part of the system, but they also may have more time to engage and build trust with the target audience. So that might be particularly worth exploring. But there was an overall feeling that despite huge challenges due to COVID, working with the campaign and health and social partners, health and care partners, had enabled stronger links between that sector and the community. So just to talk a little bit about engaging with community organisations. Now, 2 of the We Are Undefeatable pilots were actually led by community organisations, but all of the other areas as well appreciated their quite unique value because they are embedded in local life. They tend to know who is most in need, can help you reach them. As a function of that, they can also provide insight from local residents. They tend to be very well trusted by those they support and have a good sense of the local services that are likely to be more relevant for their constituents. They also tend to be quite well networked, so they can support a ripple effect in terms of, you know, whether you're working with them to help recruit volunteers or to help you get the messages out there. And an example of this was in Bolsover, where the pilot lead, Bassett Law Community and Voluntary Service, due to other work they were already doing to encourage people to get the COVID vaccine, saw an opportunity to promote physical activity information at vaccination centres, so really helping to get the message out there because of the linked work they were doing. One of the hallmarks, of course, of these organisations is their responsiveness to community needs, and many have obviously pitched in during the pandemic to support vulnerable or isolated people. But that does also mean that they can be very stretched, as ultimately, of course, there's a limit to their capacity. Moving on just to talk a bit about charity partnerships. Now, of course, one of the things unique to We Are Undefeatable is the national charities that back the campaign, but it is important to say that national charities don't all have the same capacity to operate locally because they're structured quite differently. But some areas found some good opportunities. For example, Sheffield built a health alliance with local representatives of 7 different Richmond Group charities, which then led to a concrete initiative with Age UK, loaning out tablets preloaded with physical activity videos, which were destined for isolated older people. Some of the areas did note that there were varying levels of awareness of the campaign among local charity contacts when they initially reached out. But regardless of that, it was actually still a really empowering thing for them to have the campaign resources and borrow from its national profile. So it was still a great thing to lean upon. And I know that the team is continuing to support the information flow between national charities and the local areas. So let's turn to engaging with volunteers and ambassadors. So many of the areas recruited local people living with health conditions to feature in their communications. And it was felt that this could really make messages about physical activity much more relatable and authentic. So they were contributing videos, blogs, engaging on social media, and all sorts of things like that. And the main learning from that kind of activity was that you do need to put some effort into keeping those people engaged through regular contact. And that could be, in some cases, more of a challenge due to the pandemic. There was one area that stood out for working with volunteers in quite a different way, and that was Wirral. Wirral recruited a team of volunteers to go out into the community and support people with health conditions to be more active in a one-on-one way based on referral. And it ended up being a really successful model that's actually going to be deployed in other ways moving forward. And the really valuable learnings that emerged from that were around the need to provide a really clear purpose. Is it about physical activity, or is the remit to support health in a broader sense? Because when you're engaging with this target audience, naturally medical related, condition related questions can come up. And the last point here really reflect the fact that volunteers are a fragile workforce. They will come and go. And so to maintain their engagement, it's important to think about how you create an enriching volunteer experience through things like training and development, for example. And Wirral actually did that really well. In many areas, workforce development was a key priority, and often it was through those steering groups that these kinds of opportunities were identified. Quite a bit of the training that took place focused on health and care professionals, both leveraging national training offers, but also creating some bespoke ones. Leeds, for example, trained GPs and social prescribers, among others, to use a new conversation prompting tool that they had developed. And as I just touched on, for volunteers, training can be part of the value proposition that keeps them engaged. There was also training for physical activity providers related to creating more inclusive environments. So lots of different things going on. Generally, training was a really positive thing that was positively received by those who took part. Some of the learnings were, not surprisingly, it was a bit hard to get off the ground initially, in some cases due to the pandemic, but with good engagement, those conversations were often picked up later on. Secondly, a strong sense that any volunteer training should be free to the volunteers is a method of engagement, it's empowering them, and it's also a gesture of goodwill, recognising that they're giving their time for free. Thirdly, it could be useful to link to signposting of physical activity offers through training so that it can plug directly into local opportunities. And finally, something that came up when non-clinical staff were being trained to support those living with health conditions was that they might really benefit from a bit more basic understanding of common conditions, or at least how to be briefed on how to respond to questions about them, which naturally can come up. So that concludes our section on partnership working, but depending on what you're interested in, there's a lot more richness in this topic in the individual sessions over the next couple of days. I'm going to move on to talk a bit about how campaign messages were adapted locally. And I think in this ecosystem of partnership working and multiple influences, it is relevant to think about who is delivering your message, or what combination of partners are delivering your message about physical activity, and what do they infuse in it. So it's fair to say when We Are Undefeatable was launched, it was always envisaged that you'd have the big media messages, but then this could be reinforced by the networks surrounding the individual. So what can they bring? Well, perhaps the messenger himself can add authority to the message, as perhaps in the case of a GP recommending activity. They may instill trust by virtue of who they are. Perhaps some community organisations fall into this bucket. Or it could be passion, which obviously can really help with people's motivation. And perhaps those working in the sports sector might imbue that kind of enthusiasm. And it may just be that a combination of all of those factors is useful. So it's just worth having a bit of a think about who is delivering the message locally. In terms of comms channels, one of the things we've seen as a result of the pandemic is more understanding around isolation and exclusion. And as a result of that, there have been some really great resources developed that might not have been developed otherwise. So things like the activity booklets, including the We Are Undefeatable leaflet, which were deployed in many places. A key example was Sheffield, which created with several partners an active at home booklet that was subsequently adapted for much broader rollout. One of the learnings with the physical resources is that in order to get them to those who need them, it was important to engage with a wide range of distribution partners, and they included things like pharmacies, food banks, community organisations, council services, and many others. So it's important that you engage with the right distribution partners and have quite a mix. It's worth considering local languages, of course, and whether you might need to provide translated material. That's something that a few places did. And a final point of interest here was that although there is digital exclusion, we need to be aware of that. Some digital information could still reach the target audience secondhand through friends, family and carers. That was something that Somerset discovered. So communicating digitally with those intermediaries in mind may also be relevant. Localizing communications was felt to help really very much with traction. So many of the areas used local ambassadors to support that, as I've mentioned, but other ways of localizing included linking to local physical activity sessions, including local scenery, images and local accents. And interestingly, as well as getting traction with the target audience in this way, it sometimes also helped with engagement of other local partner organisations and raising the pilot lead's own profile as a bit of a reference point for the agenda. Some watch outs here were that localising obviously requires some resource, so you may need to plan ahead and get the support of comms colleagues. And another learning was that it could be sometimes more challenging to recruit people from more deprived backgrounds to show diversity or to represent diversity within local comms, it could be a bit more challenging to get some of that those people on board with it. So it could take more time, but obviously worthwhile doing. Before wrapping up, I'd just like to touch on physical activity offers. And while the purpose of the investment wasn't to create new activities, in some cases, Insight did suggest there was a gap in provision or a gap in knowledge about provision. So here are some of the activities that were linked into or developed based on that insight. And interestingly, walking groups come up time and again. They appear to be a very popular activity in many places, obviously a very accessible form of activity. You can have a range of levels, but you see here quite a few other types of activity as well. And in terms of some of the key learnings, one of them was it doesn't have to be brand new activity at all. Very often promoting existing physical activity offers is quite effective. Of course, it needs to be linked to insight on local needs and wants, but a general point of interest was that for this target audience, for people who are more distant sometimes from activity, it can be extremely important to emphasise the social aspect as a hook. Looking at sustainability, two things on this. Firstly, it can be a really good idea to involve delivery organisations in the design and conception of new offers, as that generates more ownership of the endeavour. And to help get things off the ground, sometimes a very small amount of funding can be enough. For example, covering venue hire for a few months until participation is strong enough for an activity to stand on its own 2 feet. And finally, use your active partnership to link into local activities. They can be a very useful one-stop shop for everything that's going on in a place. So just to wrap up, what might the future hold for our places and what can you take from all of this? Well, an overarching reflection from the areas was that being involved in We Are Undefeatable as a pilot had fueled prioritisation of physical activity at a strategic level across many different partnerships. In terms of the achievements, they were most likely to discuss the partner relationships they had built or strengthened and were very much looking to maintain those. Some areas had used particular approaches that had proved to be successful models to leverage moving forward. In other areas, for example, Kirklees had used a very collaborative process of insight and co-creation, and Wirrell's volunteer programme is also going to be a blueprint for other areas of health outreach. Quite a few of the resources and the ambassador programmes are going to be continue to be leveraged, as well as the physical activity offers and signposting. So there was a quite good sense of momentum. So what can We Are Undefeatable do for you? Well, as we've seen in the pilot areas, the campaign can really help to prioritise this agenda. Part of that is being a national reference point, and part of that is also having access to high quality campaign resources that are available on the Supporters Hub, some of which are listed there again in the blue box. Something that the areas also mentioned is how it can unlock a common language around physical activity for those who have health conditions. The fact that it isn't just about high intensity sport and exercise, it's about moving more in a way that works for you and working around the ups and downs of having a long-term condition. There's guidance on this in the campaign narrative on the Supporters Hub, and the areas have told us that that's been quite empowering. And finally, as we've heard throughout, it can open up the possibility of new or strengthened partnerships across a range of sectors. So, looking at the time, we're right on the end here. That's all I had to share. Thank you so much to everybody for joining and for listening. I really hope you'll join some of the area sessions too over the next couple of days. If you'd like to join other sessions and you haven't managed to register, while formal registration is now closed, you can still access the meeting links directly. There's a link to all of those in the invitation you would have got for this session. But if there are any problems at all, my email address is shown here at the bottom. Please just get in touch directly. Thank you.